Good morning, Dr. Thompson. How are you doing today?
I'm great. How are you?
I'm fantastic. I am so excited to have this conversation with you about the work of D-CHEA and our partnership. I've been with SEMHA now almost a year and a half. It'll be 2 years in May. And one of the central things when I came on board was helping kind of lead the backbone efforts, the convening efforts of D-CHEA and helping, kind of push the work forward as we kind of build a partnership and build things out. So today, we wanted to highlight as a part of the SEMHA newsletter, health equity newsletter, we wanted to highlight the health equity work of D-CHEA and the partnership with SEMHA. So first up, tell us, what is D-CHEA?
So thank you for that. So D-CHEA is the Detroit Community Health Equity Alliance, right? CHEA, right? So, but to understand D-CHEA, we first need to understand checkup. So I am a professor at Wayne State University, Department of Oncology in the School of Medicine. And I have been doing health disparities and health equity research for a number of years now. And over that time, I have worked with two very brilliant groups of people, right? I've worked with colleagues who are other scientists. I'm a clinical psychologist and a behavioral researcher and a community-based researcher. So I've worked with other scientists and researchers on a range of projects. A lot of my background is in cancer prevention and control and cancer survivorship. And I've seen people put together brilliant and really great interventions and do great projects. But there's not necessarily been a lot of community involvement in kind of developing those projects. And even though they might have an intervention and the intervention even has impact, right? And is really making a difference for people, because there's no community involvement, it's not sustainable, right? It's actually not implemented in communities and in real world settings where it could make a difference, right? And there are times also when sometimes, yes, they may work in one setting, but because they didn't have community impact, it really is some aspects of the intervention may not be appropriate, right? When you actually try to implement in the real world. So that's one brilliant group of people, but the other great group of people are my community members, right? And community stakeholders who are context experts, right? In terms of what is happening when it comes to health outcomes and problems in the community. And people are doing fantastic projects and grassroots efforts and beyond the grassroots, doing great projects, but they may not have a great grasp of evidence-based practice and what the literature and the research shows works and what doesn't work, right? And there may be needs there in terms of evaluation and data collection and management and analysis, right? So, that's kind of a challenge there. So, checkup is a Wayne State University initiative that I oversee that stands for the Center for Health Equity and Community Knowledge in Urban Populations. And it's a way of bringing these groups together. How can we bring our content experts, right? The scientists and the researchers who know a lot about these specific health topics, whether it be cancer or cardiovascular disease or mental health, and really have them collaborate with our context experts, right, in the community, right? People who are on the ground and making things happen in real world settings. So that's the context. Let's check about really community academic partnership for research and for health equity research. And D-CHEA is kind of housed within that center, right? And it's a way of really taking everything I just said and really trying to put it into practice through a coalition of like-minded people who want to work together on some of the health problems that our communities face. So hopefully that wasn't too long-winded, but that's the
No,
background.
but you know what? That's the thing. As we, kind of work to demystify all of the acronyms in
Mm-hmm.
healthcare and public health, and so it's wonderful that you took time to kind of break that down for us, so we
Yeah.
kind of learn more intimately what the acronyms mean and
Mm-hmm.
really their impact in the community. So, real briefly, who are some of the partners at the CHEA?
Well, certainly SEMHA, right? Your organization was really integral to even starting D-CHEA and bringing partners to the table, bringing community-based organizations to the table. We certainly had a number of faculty at Wayne State University, different scientists who were interested, and many have remained really committed and involved throughout the past, I guess it's about a year and a half since we came into being. Um, so SEMHA also brings just tremendous knowledge about public health and public health initiatives in our region. So that's one key partner. And it was really help to convene this great group of people. But we have over 20 partners now, community-based organizations that are part of it, including the Detroit Parent Network, the Detroit Community Care Network. SEMHA was really important in bringing community development organizations to the table, like Genesis Hope, and Island View and the East Side. Hope Village Revitalization, right? So those are Cody Rouge, their community development organization. They're all at the table, as well as other organizations as well. Um, and we also have faculty, like I mentioned, who are part of this, and some staff, and then community residents, right? Neighborhood residents who don't necessarily represent an organization. Now, they might be linked to a number of organizations and maybe may lead, have a leadership role in some, but they're coming really as representing their neighborhoods, their communities, and themselves, kind of like the layperson.
Well, that I have another question that popped up for me, and if we have time, we can circle
Hmm.
back because it seems like the proximity of all of these organizations together can really stir up powerful conversations that can really change the narrative and focus on what's going on in the community by bringing in that
Hmm.
community voice, that stakeholder voice. It's like, well, if we're here to serve and benefit everyone,
Hmm.
then everyone should be at the table. And I think it's beautiful that you work to include that community voice in your work, because if people if they don't always see that you're there to benefit them, then
Yeah.
that can be pushback on a very good effort, but bringing people in to get a consensus that involves the community, then they're not asking the question, "What did you ask us?" And
Hmm.
I think that approach that you're taking really eliminates that because now it's not just they have a seat at the table, but they have a voice at the table, and I
Yeah.
think that's an amazing approach. Can you kind of talk to us a little bit about the future of your work, whether you want to look at it through the lens of checkup or through the lens of the CHEA? What is kind of the future of the project?
Well, it's exciting because, one of the things that was really important let me actually take a step back also, just to reiterate for whoever may be watching that, as a researcher, someone who's a very much an academic who came back, I've only ever had an academic career working at different universities and medical schools. I was trained about 25 years ago. That's when I originally got my PhD in clinical psychology, but we were not trained to work and collaborate with community members. That is not a part of even the way we conceptualize the work that we do, that most people were not trained that way. It has shifted quite a bit over the years, and there's certainly more of that consciousness and awareness. And even there are more junior researchers who are being trained today, and that's community engagement, right? That's the key word here. Community engaged research. Community engagement is a bigger part of what they do, but it still needs to spread right throughout people, who do work like I do in the context in which I do my work. So I think that's really important, because again, we have, we are holding a lot of expertise, and we need to, it's our responsibility, I think, and our duty to kind of share it, right? And make sure that others have access to it. That's part of our role as educators, even being in a university setting. That is, to some degree, even if you spend, like me, I spend actually 100% of my time doing research, but I still have a role in training and education, and that's one way to do it. So I think that's really important. In terms of the future of D-CHEA, we have particular areas of focus, and you're aware of this, that there are certain topics that have come up, that continue to come up, and now we are really getting more focused in terms of thinking about food access and nutrition security and all the things related to that, and the health outcomes related to that. So that's one area where we have really, again, it's been a ongoing and conversation in D-CHEA. And we know that what those challenges are in Detroit and Metro Detroit. So we're actually now in that area starting to think about, okay, as a coalition, because again, we have all these people at the table, the whole point is, what do we have to bring to the table that we can leverage in our work together for change? And so now that we've gotten really honed down into this area, it really allows us to think about this in a different way. And we're writing grants and papers and creating pilot projects to kind of test some of the ideas about what does it look like to work collaborative in this area, right? So, because again, you can, hopefully got a sense of that. We have some diverse groups at the table. We have organizations doing like community gardens, and we are in urban farming, right? And then we have faith-based organizations, and we have organizations that are dealing more with with social determinants of health, right? And thinking about, how do we connect people to kind of resources around our community. So a lot of different types of people at the table. And so that makes it really exciting. The other area that we're focusing on has to do with social determinants of health and even thinking about how then digital access, digital equity, kind of access to that space also can influence how people are able to get their social needs met. So again, diverse people sitting at the table and thinking about thinking this through and how do we work creatively and collaboratively for change. So again, I want to point out that our D-CHEA is only like a year and a half old or so, and we've really been focused on building a foundation, building relationships, getting to know each other and what people bring to the table as organizations and representatives, and now we're able to move forward. So it's a really exciting time for us, I think, in terms of what the future might bring.
I'm so glad that we did this interview because when I come to the meetings, often, when we hear this number about the life expectancy difference among African Americans in the city versus those that live outside of the county,
Mhm.
I think is 10 to 15-year
Mhm.
difference in life
Right.
expectancy. That's scary, but to know that there's an expert like you and others with the community focus that are really looking at how do we address these issues? How do we tackle these challenges and
Mhm.
opportunities? How do we do that together? So it's wonderful that we have
Right.
a valued community stakeholder like you doing this wonderful work, trying to help us be healthier. And so with that, let's approach our last question. What ways have benefited your work partner with SEMHA?
I'm going to say something kind of maybe a little unexpected. And please jump in because I want to make sure I kind of capture this. But, a real challenge for people like me who want to do really community engaged work, who really want to bring in community members, not only as partners in their work, but even leaders in their work, has been how do we it's been compensation, right? And making sure that people are compensated for the work that they contribute. This was not always the case. Again, this whole history of community engagement and research and the academic world is
Right,
still kind of relatively new, right?
right,
And universities and research institutions are used to looking at community members as research subjects or research participants, right? Not as actually partners and collaborators in the work. And actually, and it's not something that is unique to Wayne State. I see it and I hear about it all across the country. Being able to pay people for their time and the work that they contribute, there are actually a lot of barriers to doing that
right,
because again, it's a different system, right? Because you have to think about the city and there's all this paperwork and there are a lot of barriers to that. And then thinking about usually other requirements on top of the HR piece that are required. So it can take a long time for people to get paid. And there are there's actually some articles and work out there about, during COVID-19, during the pandemic, the NIMHD, the National Institute for Minority Health and Health Disparities, and other NIH, National Institutes of Health, agencies were trying to work on the ground with community organizations to right during the pandemic to keep people safe, to get people tested, which was important. But it took them months and months for these community organizations to get paid. So even at that level, things got really sticky and tricky. And SEMHA actually has helped us with that process and helped it make it easier, as being like a fiduciary agent, an external fiduciary agent for us, so that we can actually pay people through SEMHA for their work. It's so much easier. It's so easy, and it builds trust. It builds like, it helps people feel valued because when you commit to like, okay, I want to involve you in my work, I'm going to pay you this amount, but it takes me months and months to get paid, or even takes months and months to get approval to be in the system to be paid,
right,
it starts to erode the relationship, right?
right.
And that's what you don't want, right? You want to be able to keep to your word and give people what you said you were going to give them. And people want to feel again valued, that they know that
Right.
their work is being valued and uh acknowledged in that way. So
Absolutely.
again, I'm coming at it at a weird angle because I know that was part of the history, right, of SEMHA doing this for public health agencies and organizations. It's been game changing for us because we know then when people invoice or it's time to get paid, it happens quickly, it happens easily, and we're hearing good feedback about it. But it's a part we wouldn't be, it's again really important for us as academics on the academic side to have that go smoothly so we can maintain strong relationships with our external community partners.
There's nothing that's validating like timely payment for work rendered.
That's right. That's right. Yeah.
When people aren't just, well, I've been to 12 meetings and you said you were going to pay me, but
Yeah.
so it feels like that undoes the humanity and capacity that you're trying to build in the person, because now it makes an opportunity feel like they're begging for the
Right.
opportunity that you ask them to participate in. So being able to help organizations meet their financial obligations is
Hmm.
one of the pillars here at SEMHA, part of our financial services. And so it is something that we take very seriously, even with me in health equity, working to be sure that there's seamless communication. If you indicate to me that there's a challenge, and I come back and I talk to our team, that's not something that I don't say in health equity. Oh, well, that's financial services. I'm not going to worry about that.
Right.
We're a team over here, and whatever information I could bring back to help support our partnerships, because it only takes one bad encounter to change a relationship.
That's right. That's right.
And so the best thing I can do is to help us meet our word and meet our commitment, and that's what drives positive work partnerships that work and thrive, is a level of not just honesty but transparency. And
Yes.
it, it, you know if we say that it's going to be Friday, or between this time span and this time span, then we have to work to make sure that it happens within that time span. And if there's a
Hmm.
hiccup, because life happens, things happen. If there's a hiccup, then there's over communication around the hiccup and why
Right.
the hiccup, and addressing, if anything. But typically, we we don't have expertise at hiccups, but we certainly
Hmm.
work very diligently to meet
Hmm.
the needs of those that we work with. And I tell you, as kind of a close parting shot here, working with you and your team, uh, you just really are a master class in excellence, determination, and grit, because you don't just talk about bringing knowledge to the people. You are the light bringer, and you create a pathway where that knowledge can flow from the ivory tower into the community, and then giving the community an opportunity to bring back and have
Hmm.
comment on whatever research we're saying is about them or that affects them, giving them an opportunity to have input. And I know that that is novel, but I think that it will bear out over time that this is the way.
Oh, I really appreciate your saying that. Thank you for that acknowledgement. We try. We're trying. So, yeah, we appreciate that. Thank you.
So with that, I just want to thank you so much for your time today and stepping in. We do this every quarter, highlight a partner and highlight a relationship, just so that our constituents in the region know the work that we're doing and the partners that are at the
Mhm.
table, really trying to be a voice for change in the community and the region. So thank you so much for your time today, Dr.
Thank you
Dr. Thompson.
thank you for having me. I appreciate it.
All right. Have a wonderful day.
Okay.